Hi everyone, I am Jabisha, lecturer of Department of Radiology, Global College of Allied Health Sciences. Today we are discuss about the topic Barium Swallow. Barium Swallow, it is the radiographic examination of the upper gastrointestinal tract. The barium swallow is performed to diagnose the structural and functional abnormalities of the pharynx, esophagus, and proximal stomach by using the barium sulfate contrast media. It may be performed as single or double contrast study in the radiology department. Why barium sulfate is used as a contrast agent? First, it absorbs X-rays and appears white on radiographs, clearly outlining the GI tract. It is not absorbed by a body. It does not react with body tissues under normal conditions. It helps to visualize the lining of the stomach, esophagus, and intestine. The barium swallow examination may be performed by two methods. First, a single contrast study. Next one, double contrast study. Single contrast study is performed for the evaluation of the motility disorders and luminal abnormalities. Double contrast study is performed for evaluation for the mucosal details of the esophageal wall. Then anatomy. The esophagus is a muscular tube. It begins from the lower border of the cricoid cartilage to the cardiac orifice of stomach. It travels behind the trachea. The esophagus has two muscular sphincters, upper and lower. These sphincters are located at the upper and lower end of the esophagus and prevent the backflow of food. The esophagus wall has four layers: mucosa, submucosa, muscularis, and adventitia. Then indication and contraindication. Indication means it is the reaction of a condition that shows why a particular test or treatment or procedure is needed. Contraindication means it is a condition or reason may a particular test or treatment or procedure that should not be performed because it may be harmful to the patient. Next, indication. First one, dysphagia. Dysphagia means a difficulty in swallowing. Then abdominal pain, blood vomiting, unexplained weight loss, hiatus hernia, esophageal carcinoma, and esophageal ulcer, and GERD. GERD means gastroesophageal reflux disease. It is the condition in which stomach acid frequently flows backward in esophagus, causing irritation of its lining. Then diverticulum. Diverticulum means an abdominal outpouching sac. It's form in the wall of hollow organ. Barium swallow is commonly used in pouch to perform the visualizing the pouch. Endoscopy may also perform to see the diverticulum. Then contraindication. In this contraindication, esophageal surgery, esophageal perforation. Esophageal perforation means a hole in the wall of the esophagus, some hole is present. Then suspected pregnancy. Then pregnancy patient should not allow into the X-ray examination. So this will be contraindicated. Then complete bowel obstruction. And then move into the equipment. Fluoroscopy unit with the tilting table attached with the image intensifier or spot film device, high speed cassette. Thin density of barium sulfate suspension for single contrast study. Thick density is for double contrast study. Effervescent powder is used. It is a gas producing agent. It is used for the double contrast study. Patient preparation. No special patient preparation is required. Fasting may be employed for 2 hours. Patient is instructed not to smoke or eat chewing gum because it prevents the proper coating of the stomach mucosa. Then move on to the procedure. For every investigation, this procedure is important. On the day of the examination, the technology should describe the whole procedure to the patient and written consent from the patient, permission for procedure. The patient is asked to remove clothing and wear a hospital gown. Then first we will move on into a single contrast study. In the single contrast study, the patient is placed in an upright position, then head is turned and the patient is instructed to take 10 to 15 ml of barium sulfate, then one mouthful, and it's used to swallow it. The passage of barium is examined by the radiologist under the fluoroscopy machine. After then, the patient is asked to take several mouthfuls of barium sulfate and swallow. During the swallowing, the radiologist observes the passage of barium under the fluoroscopy screen, and if necessary, spot films are taken in AP, RPO and LPO position. All exposure should be made in suspended respiration. Again, several mouthfuls of barium sulfates are given to the patient and take a full-length films through spot film device. The films are taken from pharynx to cardiac orifice of the stomach before the esophagus emptyings. Then we will move on into the double contrast study. In double contrast study, the patient is placed in an upright position, then an injection of hypotonic agent buscopan or glucagon is given to the patient. After the injection, one mouthful of high density barium sulfate is given to the patient and asked to swallow. The passage of barium is explained by the radiologist under the fluoroscopy machine. After then, the effervescent powder is given to the patient, another mouthful of barium sulfate. The radiologist absorbs the passage of barium under fluoroscopy and spot films are taken during adequate distension of esophagus in AP, RPO and LPO position. During this study, the injection buscopan keeps the esophagus distended and effervescent powder produce gas and tends to stay up and distended the esophagus. A double contrast study evaluates the mucosal details that are useful for diagnosing the mucosal diseases like polyps, inflammation and erosion. Commonly, single and double contrast study followed to evaluate the mucosal details of the esophageal wall. Then very important, aftercare. The patient is advised to increase the fluid intake to avoid constipation. Then the patient is inform the patient about the feces will be whitish for 2 days. Not panic about this. The patient will be allowed to leave the examination room after completion of the study. Thank you.